So for this video, we're going to be working on this proper hip extension. And the prerequisite for a good hip extension is the ability of the diaphragm to fully lengthen. So this is what I mean about the breathing sort of underlying everything you do in terms of proper movement. If you get the breathing right, then everything else can start from a better position. And if you don't get the breathing right, as far as I've seen, you're kind of wasting your time with anything else. So that's why I love breathing. So we're starting in the same position. So if you're onto this exercise, then that would mean that you're comfortable with the cogs, that relationship. If you're not comfortable with that yet, I wouldn't go to this yet. I would go back and keep practicing that, and that can take a few weeks. So don't force it. This is a lifetime of practice. This kind of exercise, you're going to keep learning from it. So don't rush it. Okay. So supposing you're comfortable with the mechanical movement, incorporating the head, ribs, and pelvis, we're going to incorporate a glute contraction to encourage a proper hip extension. So the glute contraction corresponds to the exhalation phase. So as I'm inhaling, my pelvis is tilting forward, my glutes are kind of in a very lengthened position. Now when I tilt back and sort of flatten my low back, they're in a shortened position, and they're in a good position to get an easy contraction. And there also means that between the two ranges, between the tilting forward and tilting back, they're getting to experience lengthening and shortening, which is really important. So you're going to inhale the same way, through your nose, comfortably, jaw relaxed, into your belly. And as you exhale and tilt this back, we're going to think of just bridging. We're not going to actually fully bridge. We're just going to initiate that bridge. Now here's the key detail. We're going to do this with a specific pressure through our feet. So if you should have your feet flat on the ground. You don't want to be pushing just through your heels. You don't want to be pushing just through your toes. You want to be pushing through your midfoot. So nice center point. If you divide your foot into four, like evenly into four, you want that nice center point, which is around what we would call the midfoot. And you're kind of thinking of squashing an orange with that midfoot, like you're flattening it down to the ground. You're not gripping with your toes, you're just trying to flatten down with your foot. And you want to do that as you begin to exhale, and you're building tension through that back line. As you build through the foot, that'll translate up into the calf, up through the tendons of the hamstring, and then into the glute. And this is what happens ideally in gait. We build tension through a proper movement of the foot, and that allows tension to build up in the glutes, which is why glute function is so dependent on foot function. So you're going to inhale as you would, keep the feet relaxed, keep the glutes relaxed, and then as you exhale and you begin to tilt the pelvis back, you're just trying to flatten your midfoot into the ground and feel that tension build up in that back line and into your glutes. And we're just going to use that glute contraction, that tension, to get an extra little wink into that pelvic tilt. So as you exhale, you're tilting the pelvis back. So here for reference, at the top of my pelvis, if I get a little extra contraction, I get that little bit extra. And that's training the glutes. It's also training good hip extension. It's training keeping the spine relatively neutral. So again, what we're trying to combat here from one of the previous videos is hyperextension of the low back in order to translate your mass forward. In order to shift your pelvis forward when you walk, you should be extending your hip by using your glute. You shouldn't be hyperextending your low back. That's not the job of those muscles, and it's going to put unnecessary stress on those joints, and it's just inefficient. And inefficiency leads to waste of energy. So what you want to do is get into a nice rhythm, inhale, and as you exhale, build up that pressure through the midfoot and bridge the hips up. You don't actually need to bridge that much, maybe like an inch off the ground, and that's it.